Two anti-aging procedures that people talk a lot about are facial fillers and thread lifts. And when we talk about using facial fillers in a modern and advanced way, we are talking about being able to lift tissue. And of course, thread lifts, intrinsically in their name, are talking about lifting tissue. So what's the difference between them, and when would I choose what? Facial fillers are gels, usually made of something called hyaluronic acid, which is your skin's natural moisturizer, but these have been turned into a gel with varying degrees of lifting capacity. Now, these are particularly useful if a face has lost volume, and it's important to remember that volume loss is a natural part of the aging process. So most of us have lost some volume in our face, which, if we're treating the face holistically, we would benefit from replacing. Now, Sebastian Cotofana, who's an amazing anatomist, described very eloquently a line of ligaments. So we have ligaments within our face which tether our skin and soft tissues to the deeper bony structures. And this line of ligaments runs from just beneath the corner of the eye here round. And if we treat behind this line of ligament strategically, we can use fillers to create lift. If we treat in front, we create fullness. So treating in the lateral face can give us lift with facial fillers. Now, threads are literally a thread, and these can be made of different materials. They can be made of something called polydioxone or polyallactic acid, and there are many different brands and designs available, and there are also permanent threads as well as the non-permanent ones. When we're working with non-permanent threads, these will usually have cogs, so little tiny barbs or small cones that help to anchor them in the soft tissue of the face, allowing the facial fat pads to be repositioned, which in principle sounds great, but in my experience works the best if you're using these as a combination treatment. If you've adequately restored the facial volume using fillers and the patient still has some drop of the facial fat pads, then some threads can give a really nice result and can reposition those tissues to a more youthful position. I will caveat this with the fact that threads are one of the riskiest procedures we have within our non-surgical aesthetics portfolio. I'm a trustee of the British College of Aesthetic Medicine, and our recent data showed that even in experienced medical hands, the risks of thread lifts are several fold higher than they are with other aesthetic procedures. So it's something to consider that even in medical hands, these procedures are more risky. They carry downtime as well, so bruising is not uncommon, significant swelling, and patients also find they're quite uncomfortable. You have to be careful with the facial expressions you make, no extreme smiling or laughing, and avoiding intense exercise for at least 2 weeks. So it's quite a big deal to integrate into your everyday routine, whereas with fillers, for most people, it's a little bit more straightforward to plan for. I'm a big fan of combination treatments, however, and if I do think a patient would benefit from a thread lift, I have some excellent colleagues who I'm very happy to refer on to. In practice, in my clinic, we tend to combine lots of device-based procedures to give skin tightening and strategic fat reduction around the jowl and the under chin area, combined with facial fillers to give people the best lift and support we can. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.